G'day everyone, I'm Dr. Claire Hudson, and I've been working as a urologist here in Australia for over 25 years. Today, I want to talk to you about something that a lot of blokes experience but rarely discuss, even with their partners or their mates down at the pub. It's a topic that brings up feelings of embarrassment, fear, and sometimes shame. But here's the thing, you're not alone. And what you're going through doesn't mean you've lost your masculinity or your virility. So let me ask you straight up. Have you ever reached climax, felt the full intensity of an orgasm, but noticed that nothing came out? No ejaculate at all? Or maybe just a tiny amount when there used to be more? If this has happened to you once, or if it's happening regularly, I want you to know that I've seen hundreds of men in my clinic who've experienced exactly the same thing. Some whisper it like it's a guilty secret. Others avoid intimacy altogether because they're worried their partner will notice. But here's what I need you to understand right from the start. Dry ejaculation, or what we call anejaculation in medical terms, does not mean you're losing your manhood. It doesn't mean your sex life is over. And it definitely doesn't mean you're any less of a man. What it means is that something in your body has changed. And in most cases, there's a clear explanation, and often a solution. Now, before we dive into the causes and what you can do about it, I want to clear up a really important misconception. A lot of guys think that orgasm and ejaculation are the same thing. They're not. An orgasm is a neurological event. It's your brain and nervous system firing off signals of pleasure. Ejaculation, on the other hand, is a mechanical process. It's muscles contracting, ducts opening, and semen being expelled. Usually they happen together, but they don't have to. You can have an orgasm without ejaculation, and that's exactly what's happening with dry ejaculation. The pleasure is still there, the sensation is still there, but the fluid isn't coming out the way it used to. Right. So, let's talk about why this happens. There are 3 main causes, and I'll keep this brief because I know you want solutions, not just a medical lecture. The first and most common cause is retrograde ejaculation. Imagine there's a little valve at the neck of your bladder. During orgasm, that valve is supposed to close tight, directing semen out through your penis. But if that valve stays open, the semen takes the path of least resistance and flows backward into your bladder instead of coming out. You still feel the orgasm, but there's no visible ejaculate. Later, when you take a leak, your urine might look cloudy because the semen's mixed in with it. This can happen after prostate surgery, especially procedures like TURP or laser treatments. It can also be caused by certain medications, diabetes that's not well controlled, or nerve damage from spinal injuries. I had a patient, let's call him Greg, who came to see me absolutely gutted after his prostate surgery. He said his orgasms felt empty. When I explained it was retrograde ejaculation and that his sexual function was still intact, he was genuinely relieved. He thought he'd lost everything, but really, just the plumbing had changed. The second cause is blockage of the seminal vesicles. These are glands behind your bladder that produce about 60 to 70% of your semen volume. If these get blocked by infection, scar tissue, cysts, or even little stones, the semen can't get through. You'll have an orgasm, but barely any fluid comes out. Blokes with this problem sometimes feel pain in the pelvis or groin during climax, or they notice their semen is thicker or reduced in volume. I remember a younger patient, around 34, who came in with his wife after years of trying for a baby with no luck. Turns out he had a cyst blocking one of his seminal vesicles. We sorted it with a simple procedure, and a few months later, they had good news. The third major cause is hormonal imbalance, particularly low testosterone. Testosterone drives sperm production, prostate function, and the muscle contractions involved in ejaculation. When your levels drop significantly, you might notice less semen, weaker erections, lower libido, and eventually dry orgasms. You might also feel constantly tired, lose muscle mass, or notice mood changes. This isn't just normal aging. It's a condition called hypogonadism, and it can be treated. A simple blood test can measure your testosterone and other hormone levels, and if they're low, hormone replacement therapy, or other medications can help restore balance and function. Now, I also need to mention that sometimes dry ejaculation can be a warning sign of something more serious. If it comes on suddenly, especially with other symptoms like blood in your urine or semen, pain when you ejaculate, pelvic pain, loss of sensation in your genitals, or fever, you need to see a doctor straight away. Prostate cancer, bladder cancer, and certain neurological diseases can all present with these symptoms. I'm not trying to scare you, but I am saying that if you notice these red flags, don't wait around. Get it checked. Right. Now, let's get to what you really want to know. What can you actually do about this? I'm going to give you 5 practical solutions you can start implementing today. Solution number 1 is pelvic floor exercises, also known as Kegels. Yeah, I know. You probably thought Kegels were just for women, but they're bloody effective for men too. Your pelvic floor muscles control ejaculation and bladder function. Strengthening them can improve the force of your ejaculation and help with some cases of retrograde ejaculation. Here's how you do it. First, identify the right muscles. Next time you're having a pee, try to stop the flow midstream. Those are your pelvic floor muscles. Now, don't make this a regular habit because stopping urine flow repeatedly isn't great for your bladder. But it's a good way to find the muscles. Once you know which muscles to engage, practice contracting them for 5 seconds, then relaxing for 5 seconds. Do this 10 to 15 times, 3 times a day. You can do it anywhere, sitting at your desk, driving the car, watching telly. No one will know. After a few weeks, you should notice a difference. Solution number 2 is diet and lifestyle changes. What you eat and how you live has a direct impact on your sexual health. If you're carrying extra weight, especially around the belly, it can lower your testosterone and affect blood flow. So, first things first, try to maintain a healthy weight. Eat more foods rich in zinc, like oysters, red meat, pumpkin seeds, and nuts. Zinc is crucial for testosterone production and prostate health. Include omega-3 fatty acids from fish like salmon, mackerel, or sardines. These improve circulation and hormone production. Eat plenty of fruits and vegetables, especially leafy greens, berries, and tomatoes. Lycopene in tomatoes is particularly good for prostate health. Cut back on processed foods, excessive alcohol, and smoking. I know that's easier said than done, but even small changes make a difference. And stay active. Regular exercise, especially resistance training and cardio, boosts testosterone naturally. Solution number 3 is supplements. Now, I'm not talking about dodgy products you find in the back of a magazine. I mean evidence-based supplements that can support your sexual health. Zinc, 15 to 30 milligrams daily, supports testosterone and sperm production. L-arginine, 1 to 3 grams daily, improves blood flow and can help with erections and ejaculation. Vitamin D, especially if you're not getting much sun, plays a role in testosterone production. Most Australian blokes are actually deficient in vitamin D. Omega-3 fish oil capsules if you're not eating enough fatty fish. And saw palmetto, which some studies suggest can help with prostate health and urinary symptoms. Always check with your doctor before starting any supplements, especially if you're on other medications. Solution number 4. And this is a big one. Talk to your doctor about your medications. If you're taking drugs for high blood pressure, enlarged prostate, or depression, some of these can cause dry ejaculation as a side effect. Alpha blockers like tamsulosin and dutasteride are common culprits. Some antidepressants also interfere with ejaculation. Don't just stop taking your meds. That's dangerous. But have a conversation with your GP or urologist. There might be alternative medications that work just as well without affecting your sexual function. I've had patients who switched medications and saw improvement within weeks. Solution number 5 is communicate with your partner. I know this might be the hardest one for some of you, but it's also one of the most important. A lot of blokes withdraw from intimacy because they're embarrassed about dry ejaculation. But your partner probably notices something's changed and might be worried that you're not attracted to them anymore or that something's wrong in the relationship. Having an open, honest conversation can take a huge weight off both of you. Explain what's happening, reassure them that you still desire them, and let them know you're working on it. You might be surprised how understanding and supportive they are. And remember, intimacy isn't just about ejaculation. There are plenty of ways to connect physically and emotionally. Now, let me address some of the most common questions I get in my clinic. Can you still have kids if you have dry ejaculation? It depends on the cause. If it's retrograde ejaculation, there are techniques where we can retrieve sperm from your urine or directly from your testicles for assisted reproduction. If it's a blockage, surgery might restore normal ejaculation. If it's hormonal, treating the hormone imbalance can improve sperm production. So yes, fatherhood is still possible in many cases, but you'll need to see a fertility specialist. What if you've had prostate surgery and the dry ejaculation is permanent? First, know that this is a common outcome of prostate surgery, especially for benign enlargement or cancer. Your surgeon should have discussed this with you beforehand. While the ejaculation might not return, your ability to have orgasms and erections often remains intact. It's about adjusting your expectations and focusing on the pleasure and intimacy you can still experience. And if fertility was important to you, sperm banking before surgery is always an option. What about after a vasectomy? After a vasectomy, you should still ejaculate normally. The volume might be slightly less because you're not producing sperm, but you should still have fluid. If you're ejaculating very little or nothing at all after a vasectomy, that's not typical, and you should see your doctor. If you have diabetes, can you still have a normal sex life? Absolutely. Diabetes does increase the risk of dry ejaculation and erectile dysfunction because it can damage nerves and blood vessels. But managing your blood sugar well is key. Keep your diabetes under control with diet, exercise, medication, and regular checkups, and you can significantly reduce these complications. And if problems do arise, there are treatments available. What about Peyronie's disease and prostate cancer? Peyronie's disease, which causes curvature of the penis due to scar tissue, doesn't directly cause prostate cancer. They're separate conditions. However, both can affect sexual function. If you have Peyronie's and are also experiencing dry ejaculation, it's worth getting a full workup to understand what's going on. Let me share a couple more stories from my practice because I think they'll resonate with some of you. I had a patient in his early 60s who came to me absolutely devastated. He'd been on medication for benign prostate enlargement for about 6 months, and during that time, his ejaculation had gradually disappeared. He said he felt like he'd lost his identity as a man. We had a long chat. I explained the mechanism behind retrograde ejaculation, and I adjusted his medication. Within a month, things improved. He still had some retrograde ejaculation, but the volume increased, and more importantly, his confidence came back. He told me later that just understanding what was happening and knowing it wasn't a reflection of his worth as a man made all the difference. Another bloke, in his late 70s, came in with his wife. He'd been avoiding sex for over a year because he was too embarrassed to tell her about the dry ejaculation. She thought he didn't find her attractive anymore. When we all sat down together and I explained the medical reality, the relief in that room was palpable. They left holding hands, and a few months later, he sent me a card thanking me for giving them their intimacy back. Look, I want to wrap this up by saying something really important. Getting older doesn't mean your sex life is over. It doesn't mean you have to accept a decline in intimacy, pleasure, or connection. Yes, your body changes. Things don't work exactly the same way they did when you were 30. But that doesn't mean you're broken. Dry ejaculation is a symptom, not a life sentence. It's your body's way of telling you that something needs attention. Whether it's retrograde ejaculation, a blockage, hormonal imbalance, or a side effect from medication, there are ways to address it. Start with the practical steps I've given you today. Do your pelvic floor exercises. Look at your diet and lifestyle. Consider supplements. Talk to your doctor about your medications. And for the love of God, talk to your partner. But most importantly, don't suffer in silence. Don't let embarrassment or fear keep you from getting help. I've been doing this for over 25 years, and I can tell you that the men who come in and address these issues head-on are the ones who maintain the best quality of life as they age. You deserve to feel confident, to enjoy intimacy, and to live fully at every stage of your life. If you're experiencing dry ejaculation, book an appointment with a urologist. Get a proper assessment. Get your hormones checked. Rule out anything serious, and then work with your doctor to find the right solution for your situation. You're not alone in this, and you're definitely not less of a man because of it. This is just another challenge that comes with getting older, and like everything else, you can face it head on. So, take care of yourselves, look after your health, and don't be afraid to ask for help when you need it. Thanks for watching, and I'll see you in the next one.